Hello everyone and welcome back to my channel. I am Kishan Davda from Neuroendocrine and I have recently cleared my USMLE Step 1 and now we'll be starting with a new YouTube series, that is USMLE Step 1 System-Wide First Aid series. Okay, so what all we'll be discussing in this is we'll be discussing about important topics in the first aid that you need to be aware about. What are the important ones, what are the less important ones. Basically there are no less important ones, everything is important in step 1. So we'll be discussing about the topics, what you need to remember, how you need to remember, and all those stuff we'll be covering in this. So today we'll start with our first system, that is endocrine system. As people who are taking guidance from me, I always suggest them to start with small system first so that they get the confidence about how to move forward. Okay, so let's start with our first system, that is endocrinology, and you can use your first aid latest edition. I am using 2022 edition, and the page number given in the 2022 edition is the endocrinology is, I can say, 331. We'll start and I will be discussing about the various aspects, what you need to remember properly. So before starting endocrinology, I would like to give you just few tips how you can master endocrinology on the USMLE. First step is that you should be thorough with your endocrine hormone functions. Which hormone does what? That hormone does that. Which hormone increases, so in counteract, which decreases. All those things you need to be aware of before you start endocrine system pathology, and before that you need to be aware about the basics. Okay, so this is a small tip. Endocrine is all about hormones and the symptoms that it will cause on the body. So make sure your hormone knowledge is proper along with the symptoms knowledge, and I assure you, you are done with the endocrinology part. That's the only thing you need to focus on. So coming to page number 331 of the first aid 2022 edition, we'll see the endocrine embryology, then we'll move towards endocrine anatomy, adrenal cortex, medulla, endocrine pancreas, and cell type. So see, in this endocrinology and anatomy are not very important, but you need to go through once. You need to know what are the basic hormones and all those stuff. That's just a memory part. One thing that you need to remember in thyroid development embryology is that you need to know what is thyroglossal ductus. How will you identify thyroglossal ductus on the patient? Midline thyroid mass, they will give you one particular topic about that, and then you need to focus on, you need to be able to identify the thyroglossal ductus. Alright, that's all for embryology. Moving ahead, coming to the endocrine physiology part. Okay, endocrine physiology part, all you need to be aware of is you need to be aware about all the hormone functions. Each and every functions matter. Okay, based on that you will be able to identify what hormones are able to cause what. As a result of thyroid, what is happening? As a result of prolactin, what is happening? Which hormone is decreased, which hormone is increased? Everything else you need to be aware of. Only then you can say you have mastered endocrinology. Alright, and along with this table is very important for your reference. If you are not able to remember the information wise, you can always go for this table. Alright, moving ahead, we can say what now. As I said, this table is very important for your summary part. And moving ahead, you can see what is like the function of growth hormone, how it is produced, what will be the effect. Then you can see the prolactin and thyroid hormones. And see, in the thyroid hormones, I would really suggest you should know the basic physiology. You should know the basic table, how it is formed in the body, how it is going out. This positive negative feedback mechanism is very important in order to know about hypothyroidism, hyperthyroidism, and all those stuff. Plus, this diagram will also be helpful in pharmacology. So I would really suggest you to memorize this table, memorize the process and everything else, and that's it. See, I'm not going to tell you each and everything that you need to know. I'll just tell you what are the very high yield. Like for sure you will be getting the questions based on that. I am only going to tell you that. Alright, so do everything, but the topic that I am saying, please focus more on that because the questions are frequently asked more on that. Coming to the parathyroid hormone is one of the underrated hormone, but frequently questions are asked, frequently. So you need to be aware about the the vitamin D metabolism, the calcium, parathyroid hormone metabolism from the body, the osteoclast activity, and everything. Okay, so this is very high yield and very underrated. You will always be confused in this. Primary hyperparathyroidism, secondary, tertiary, they will confuse you with that. Alright, so make sure parathyroid and thyroid, these two are the most important that I am telling you right now. Ahead to the insulin, the calcium homeostasis, you can just read it and remember it. But then moving to the insulin, if you are not able to understand any single point in the insulin, I would really suggest you go for Ninja Nerd lectures on YouTube. He has explained the insulin in such a proper way, in such a beautiful way. It involves your biochemistry aspects, your physiological aspects and everything. So you don't need to focus on other things. Alright? Then doing about the insulin everything, this is also very important. These two diagrams are very important. Ninja Net has beautifully explained them. You can easily see that. Alright? Each and every information here is very important in insulin. Moving ahead to the adrenal steroid and congenital adrenal hyperplasia. They will ask questions. Maybe they consider this in the reproductive system, but consider this here only and get it done. Only the three hormones for now that you need to remember is this three table. They will give you the potassium level, they will give you the BP, they will ask you the mineralocorticoids, and this presentation, each and everything here is very high yield, very important. Only the three disorders, 17 alpha hydroxylase, 21 alpha hydroxylase, 11 beta hydroxylase. Remember the features, remember how to identify them. You can see the boards and beyond, and just this is very important. Just do it. Moving ahead to the cortisol part. Cortisol part is just you need to remember the cortisol functions. Alright. So based on these functions, you will be able to identify what happens in Cushing syndrome, what happens in Addison's disease, and everything else. Alright. So remember these functions. It will be very helpful for you. One important point over here that everyone gets confused is this eosinopenia, lymphopenia, and neutrophilia. Alright, this is very high yield and very confusing at times. Alright, so make sure you know with neutrophilia and not neutropenia, and it's eosinopenia, and that's all thing. Coming to the next page, that is on page number 343 of first 2022 edition. This signaling pathways of endocrine hormones. This is very difficult to remember, but at the end you have to remember. You have to. You will definitely get 3 to 4 questions in your exam from this. Alright, so one thing how you can remember is either you follow the mnemonics, or you can try yourself. Do anything. Okay, just try to remember them. More and more question solving can also help you. Alright, so this is all about the endocrine physiology part that we have covered till now. Thyroid, parathyroid, cortisol functions, and insulin. These 4 are the basics, and the same thing will be going in the pathology. The same amount of high yield substance will be going in pathology. Alright, so make sure your physiology is clear. Physiology clear, then only you can clear your pathology. And pathology is clear, only then you can clear your pharmacology. Alright, so make sure these 3 are the basic subjects, and the same thing will be again asked in the step 2. So why not do it here to the very detail. Alright, you will be very lucky to have me to create this thing, because I am teaching pathology to many students. Currently I have a batch of 15 to 20 students, and based on that I have taught the pathology in endocrine based on my experience in UWORLD and the real step 1 exam. So what I will do is I will be discussing each and every condition, and I'll ask you, or I'll tell you what is the important point that you need to remember particularly in each and every condition. Alright, let's start with the first condition, that is SIADH in the pathology of endocrine system. So SIADH, remember what hormones are released, remember what is the sodium level. Alright, it is the hyponatremia here. Remember aldosterone, ANP, BNP levels, and also one more important thing that you need to remember is ectopic ADH, that is small cell lung carcinoma. So basically you have to understand the pathophysiology. You can see that in the book. And secondly, all 3-4 points that I have mentioned, they are very high yield. Alright, moving down to the primary polydipsia and diabetes insipidus. This table is very important. It will help you to distinguish between all the 3 conditions. Alright, so desmopressin administration, treatment, and water restriction, they will help you to distinguish how it is going on. Make sure how you are able to distinguish between central DI and nephrogenic DI. Primary polydipsia. Alright, so these 3 are very important. You may see that it's of no use, but believe me, they will definitely ask you in the graph form. They will give you the graph of ADH, and then they will ask you if ADH is increasing or not increasing. You need to know ADH is increasing what, ADH is decreasing what. So you need to know all of that. Ahead, coming to the hypopituitarism. Hypopituitarism, basically you all know the definition, but here what they will focus on Sheehan syndrome. They will always give you a case saying a pregnant female. Okay, a pregnant female, after delivery she is not able to live properly, very depression, don't have enough strength, and all those stuff. So make sure Sheehan syndrome is covered in hypopituitarism, and you are able to recollect it while solving it. Second thing, Moving on to the pituitary empty cell syndrome and pituitary apoplexy are also very important. You can when you solve the UWORLD, you will come across 2 to 3 cases about that. But Kishan syndrome is the ultimate. Alright, moving ahead, acromegaly, as you all know the features. Okay, I am not going into the features here. One thing important is investigation of choice. It will be oral glucose tolerance test. Alright, not IGF level. You won't test for IGF first. You will go for oral glucose tolerance test to diagnose acromegaly. Alright, don't get confused. Just stick to the information given in first aid. Now coming to the one of the most deadliest and one of the most high yield part of the endocrine, that is thyroidism. What you need to do is you need to understand all the features, hypo and hyper. Based in the question, they will tell you a woman with she sweats a lot, she feels hot very much. These 2-3 symptoms will definitely be given, and you should always think about that it's a case of hyperthyroidism. Don't think about it as a grave disease, it is a thyroid trauma or anything like. First duty should be to identify whether it is hyper or hypo. Alright. Second duty, you will be estimating the lab values TSH, T3 and T4. Alright, and they will ask you one question, which is the most sensitive test? Okay, which is the most appropriate test? Your answer will be always the TSH levels. Okay, always the TSH level should be your answer. So basically, the first duty, when you find a patient, when you find a question of thyroid, always find whether it is hyper or hypo. Based on that, you will be able to identify the symptoms, and all the symptoms are very important. And one of the most important confusing one that you will get here is the musculoskeletal system, the hypothyroid myopathy and thyrotoxic myopathy. The only differentiate is increase in creatine kinase and normalcy. Rest all are easy to differentiate it, but that's myopathy, you will be confused. Alright, so make sure each and every system what difference occur in thyroid. Alright, moving ahead to hypothyroidism first, that is the thyroiditis. There are 4 to 5 types of thyroiditis, and each and every one of them is very important. The most common being the Hashimoto and Decurvin, that is subacute granulomatous. Renal and congenital, they won't ask you so much, but these two are very important. Hashimoto, each and every line is important. Alright, especially HLA-DR3 and this antiperoxidase, antithyroid peroxidase and antithyroglobulin. They always ask for the antibody, or in the question they will give for the autoantibodies, and you need to identify them. Alright, another important thing, in all those thyroiditis, you need to remember the findings and histology. Histology is very important in the first step, and the step 1 examination. Histology is very important. That is how to test your pathology. Alright, so you need to remember the histology and findings. Now, as I told you, Hashimoto and subacute granulomatous. Hashimoto is the most common. If you're not able to understand the question, always go for Hashimoto. Think about the autoantibody and HLA levels. Second, subacute granulomatous thyroiditis is the only thyroiditis that will involve pain on the neck when a patient is of hypothyroidism. Alright, the question will be, there is a lump and there is a pain. Okay, and pain due to thyroid gland is only seen in subacute granulomatous thyroiditis, that is Decurvin. You can see the Decurvin vein pain. Alright, so these through 1 and 2 are very important, but don't forget the rest. In rest, histology and findings are very important. One important thing in renal thyroiditis is you should be able to identify it from anaplastic carcinoma of thyroid gland. Alright, so just make sure you read each and everything. And as I told you, histology is very important. So all the images, please, I request everyone to get fix the images in the brain, what the images you are seeing in each and every thyroid condition. Alright, that's all for thyroiditis. Moving on to hyperthyroidism, the only thing that is important here is grave disease. Each and every point, the pathophysiology given here, this pathophysiology, this HLA-DRC, the autoantibodies here. Okay, why autoantibodies are important? When can you say the autoantibodies are present in the system, in the disease? When? Because it is an autoimmune disorder. All the autoimmune disorders will have autoimmune antibodies. Alright, so make sure you know what diseases are autoimmune. Based on that only you will be able to identify the autoantibodies. Okay, in normal disease there is no autoantibodies. Okay, so make sure grave disease is very important. And the second thing over here that I want you to remember is George-Basdow and Wolff-Chakoff effect. In the physiology you will come across them. Alright, they both are opposite to each other, so make sure you know about them. Coming to the thyroid cancers, same thing that I told you in thyroiditis. Okay, see, thyroid adenoma is also one of the type of thyroid cancer. Fix the images in the brain and read what is given. Okay, Moving ahead, all different types of thyroid cancer. This is very thyroid is very high yield and high scoring, easily scoring. Okay, you can easily score. Remember the images, remember the information, and go with it. Okay, samoma bodies. Then you see if papillary carcinoma is there, they will give you prior history of radiation. Okay, the neck surgery, neck radiation. Okay, if follicular carcinoma is there, they will give you good prognosis, and then they will give you ppx and all the stuff. Okay, medullary carcinoma is there, men2 men-tb is there. A myeloidosis will be given, perifollicular C cell, that is from a parathyroid gland and all the stuff. And medullary carcinoma is always associated with pheochromocytoma. Alright, pheochromocytoma is one of the adrenal medullary disorders, so make sure you can able to interrelate between them. Alright, so that's it for the thyroid carcinoma. So thyroid and thyroid is very important. Thyroiditis, hyperthyroidism and thyroid cancer, each and everything. In hyperthyroidism you can leave all those, but remember grades very high. And coming to the parathyroid gland, as I told you, parathyroid is very underrated, but you will be tested very sharply on that. Okay, so hyperparathyroidism, secondary hyperparathyroidism and hypoparathyroidism, only these three conditions are there. But in hypoparathyroidism you need to remember pseudo hypo and pseudo hypo. What happens there? The main the main feature how you will be able to identify pseudo hypoparathyroidism is by looking at this sign. This sign is Albright hereditary osteodystrophy. Okay, so make sure you are able to remember this. And coming to this, if you have a very sharp memory, if you don't want to think about the concept during the exam, this table is again very helpful. If you are able to understand it, that's the best thing. If you're not able to understand it, skip it and try to memorize. That's all you can do, because this table is very important and very high yield. So make sure your concepts are clear before you go for your exam. Alright, so this was for hypoparathyroidism and hyperparathyroidism. Each and everything is very important, very important. In hyperparathyroidism, don't get confused. They will give you, there is a bone pain, there is a mental disorder, high calcium, phosphate low, high PTH, what occurs when, vitamin D levels, everything you need to focus on. Okay, so hyperparathyroidism, you can always Google the images, the vitamin D metabolism, how vitamin D is produced in the body from sunlight, that flow chart. Please note this down and get it done. It's very important. Alright, so that's all for the most common disorders in India, that is diabetes mellitus, both type 1 and type 2. Okay, first of all you need to know how diabetes occurs. For that you can go back to the physiology ninja nut video, watch it properly, and then come to the boards and beyond of this part. Alright, so in diabetes, what all you should know? You should know how many types, type 1, type 2. You should know the biochemistry aspect, gluconeogenesis, glycogenesis, glycogenolysis, lipolysis, and all those, which will increase, which will decrease. This is very important. Okay, distinguish between type 1 and type 2. Type 1 occurs in young people, type 2 occurs in elders. Insulin is required in what? What is the basic mechanism? Okay, it is given in first set also in the next page, like on the page number you can see the page number 353. They have given this distinguish. They have also given the autoantibodies here. They have also given the HLA, and this histology is again very important. Histology in pathology is very important, so make sure you are able to remember each and everything. Alright, so type 1, type 2, along with that the biochemical aspect you can easily see in the flowchart given. This is the biochemical aspect. Based on that you will be able to identify this pathophysiology. Okay, so pathophysiology is what they test on and where you lack, because pathophysiology is not taught in our Indian colleges. Another thing, the complications of diabetes mellitus. Complications, what complications increase? Complications include the renal problem, the retinal problem, that is the eye problem, then atherosclerosis. All those basic mechanisms you should know. Along with that, you should also know how you diagnose it, which is the most, you can say, most common and the most easiest way, that HbA1c, the value you should remember. What all these tests are, you should remember. Diabetes mellitus is very common and you should know each and everything about that. Alright, so that's all for diabetes mellitus. Make sure you are expert in this topic. Along with the diabetes mellitus, there are two other things that you need to study: diabetic ketoacidosis and hyperosmotic hyperglycemic state. What you need to do: presence of insulin or presence of ketones. What are they? Osmolarity, potassium levels in both of them. Alright, and glucose levels. Glucose levels, if it is greater than, I think 160 or 200, greater than 200, you can say 360. I'm sorry, greater than 360, then I think it is DKA, that is diabetic ketoacidosis, which is greater than 600 or greater than 550. You can say hyperosmotic hyperglycemic state. Okay, try to identify themselves. More and more question solving will get your doubt more and more clear. Alright, so this is very, very important. Don't skip this. To the adrenal gland disorders. Adrenal gland disorders, there are cortex disorders and medulla disorders. First, we'll start with cortex disorders. In cortex disorders, we'll be doing 3 syndromes: Cushing syndrome, Addison disease, and one more is the Conn syndrome. Alright, so in Cushing syndrome, all you need to do is just see the finding. Okay, just see the finding. You findings are all everyone knows. Okay, everyone can know the finding, but the main funda is step 1 is you should know the pathophysiology, what is causing that finding. Alright, so in the Cushing syndrome part, in the first aid that is given on the page number 354 of first aid 2022 edition, you can see the etiology, by heart the etiology. Okay, by heart it. That's very, very important. And second thing that they will test is the diagnosis method, the flow chart that is given here. They will test it. They will say after giving high dose dexamethasone, or what will happen if there is no suppression, or if there is suppression. If there is suppression, what to do next? If there is no suppression, then what is the answer? What to do next? MRI of pituitary or CT scan of chest, everything like that. Okay, they test it. They are very, very nasty. They will play with you. Alright, so etiology and this flow chart, that is the diagnostic test. These are very, very important. Moving ahead to like adrenal insufficiency, the primary, secondary, and acute. That is here in acute you will be knowing Waterhouse Friderichsen syndrome, that is caused by Neisseria meningitis. Okay, so Neisseria. So you need to link to Neisseria and bacteria. Link to Neisseria. They might give you the symptoms of Neisseria bacteria, and then they will ask you to identify what adrenal gland problem is there. Alright, primary adrenal insufficiency and secondary adrenal insufficiency. Main distinguishing feature will be the levels of this hyperkalemia and hyponatremia. Okay, hyperkalemia, potassium levels, sodium levels, they are very, very important. Secondly, what is the reason for primary? That is decreasing gland function. But what is the reason for secondary? Decrease in the pituitary disorder. Because of pituitary disorder, aldosterone is secreting less. Okay, but in the primary there is a problem in the gland. In secondary, gland is functioning normally, but the pituitary is not functioning normally. So all those things you should think about it. Wherever you hear the secondary means the gland is not having a problem. The problem is occurring from something else and it is affecting your gland. Alright, to make sure you know the differences between them. And now moving ahead to the last, that is hyperaldosteronism, increase in aldosterone. It's known as the Conn syndrome. There is primary and secondary here also. So in primary what happens, secondary what happens? Simple. There will be this hormone levels. Okay, hormone levels. In the secondary, renin will increase, but in primary, renin will decrease, and aldosterone increase. So based on that, you should be able to identify them. Is that clear? Adrenal gland is done. The 3 important things: Cushing, Addison, and Conn. Cushing, etiology and diagnostic test. In Addison, primary, secondary, and Waterhouse Friderichsen. And in Conn, primary and secondary. You need to be able to identify them. That's the only thing. Now coming to the neuroendocrine tumors. What are neuroendocrine tumors? Arising from the neuroendocrine cells of the body. The 2 tumors that you need to remember is neuroblastoma and pheochromocytoma. Alright, everything will be same here. Okay, everything will be same. Pheochromocytoma will be in adults most commonly. Neuroblastoma will be seen in the children. That's how they are at this level, at a step 1 level. Okay, so let's study about pheochromocytoma. What all important point? You need to know the genes. You need to know the like symptoms. There will be mention of episodic. Episodic word will be there. Episodic high BP, episodic sweating, episodic palpitations, and all those stuff will be given in pheochromocytoma. Okay, and make sure you know that is a tumor of adrenal medulla, not adrenal cortex. Okay, and how you will diagnose it? The findings are given: increase in catecholamines and metanephrine, HMA, VMA, all that. This is the only condition where this like hormones are decreased, these enzymes are increased. Same will be in neuroblastoma, but neuroblastoma is in children. Pheochromocytoma they will mostly ask in adults. So make sure you know like that. Okay, and one other important thing during the treatment. In the treatment, you need to know alpha blockers will be given first or beta blockers will be given first. This is very, very important. They have asked the question so many times. I got this question in exam myself. Okay, make sure all this you need to remember in pheochromocytoma. Moving ahead to the last part of our endocrinology, that is in the pathology part. The main syndromes are very, very important. They will ask you this condition and then they will ask you in the option what is the genes associated with. When meant to A, meant to B. So you should be able to identify that. Okay, easy way to identify is you can always look for the hint given here. Men 1, 3 P, men 2 A, 2 P, men 2 B, 1 P. This is very important. Endocrine, as I said, totally on your hormone. If you understand the hormone, you are master in endocrine. If you have any one question, one doubt in the hormone, you are dead. You will be confused. Okay, that's all for endocrine pathology. Let's move on to the pharmacology. And let's move on to the last part of the endocrinology, that is pharmacology part. Okay, pharmacology is very important, and the most important thing in pharmacology, only the two drugs for diabetes and drugs for thyroid. Nothing else you need to remember. Nothing else. Don't waste your time. Just go it for the glucocorticoid that you will be studying in that is separate in NSAID along with NSAID. Okay, but if you get time, just go through glucocorticoid. Don't leave that. That is also very important. But you will study that with NSAID. Okay, here anti-diabetic and anti-thyroid. Each and every drug is very important. Okay, so I'll just tell you. You have seen the insulin preparations given. The graph is very important there, and try to analyze the graph, what they are explaining in the graph, which like what insulin preparation will be for a longer period of time, what for shorter period of time. Everything will be given, and they will give you the hours, like the effect is there for 2 to 3 hours, the effect is there for 4 to 6 hours. What you will do, which drug it is, they will try to ask you like this. Okay, and this is very confusing, and you need to continuously revise. Only thing is continuous revision is the only key. Okay, moving ahead, all these drugs increase sensitivity, secretion, glucose induced insulin secretion. Each and every drug along with their side effect, mechanism and side effect that the pharmacology tests. Mechanism and side effects. This is the only way how pharmacology will be asked. They will give you a case, they will tell you the drug name also, then they will ask you the mechanism. They will give you the case, they will give you the mechanism, and you will have to find drug name, and then you will have to find the side effects. Okay, they will test you like this. Okay, so each and every drug of diabetes is very important. Alright, moving on to thyroid, there are only 3 drugs that you need to remember: propylthiouracil, methimazole, and levothyroxine. That's it for pharmacology from my side. These are very important. Same thing, mechanism, side effect, and sometimes they might ask you contraindications also, when you should not give, during what time you should not give, during what time you should give, during the pregnancy you can give or not, during the pregnancy this will be affected or not. Each and everything is important. Alright, so focus on this diabetes and antithyroid. Hello guys, with this we finished our first video with the series of USMLE Step 1 system-wise review with the first aid. So this was all about the endocrinology. I covered each and everything that was important. Okay, and since this was our first video and this is a small system that have gone so fast, and I tried to cover each and everything in this video. Whereas the systems will be big, like CVS, CNS, GIT. These are big systems, so I will be making them in 2 parts. Alright, endocrine is a small system. Make your hormones clear, make the functions clear, try to understand the feedback mechanism, up, down, everything, and 5 things that you need to remember in endocrine. Thyroid is very important. Each and everything, pharma, patho, physio, each and everything. Okay, insulin, pharma, patho, physio, each and everything. These 2 are the highlights of endocrine system. As you can see in the pharma also, I have told you to remember anti-thyroid, anti-diabetic drugs and everything. Okay, each and everything you should know about them. Coming to the third, in the adrenal tumors, Cushing syndrome, etiology and diagnosis. Addison syndrome, primary, secondary distinguishing. Along with that, Waterhouse-Friderichsen syndrome, associated with dysphagia. Third, Conn syndrome, primary, secondary, hyperaldosteronism due to renin or not. And in the adrenal medulla, pheochromocytoma. Okay, coming to the pituitary gland, acromegaly, investigation of choice. Sheehan syndrome, when it occurs, what case will be given? Pregnant female. Then SIADH, diabetes insipidus and primary polydipsia. All these 3 conditions, you should be able to identify them. Okay, 3 conditions: SIADH, primary polydipsia and diabetic insipidus. Diabetic insipidus are of 2 types. So in total 4 conditions. Alright, and what all you need to mug up is MEN syndrome, MEN syndrome, and the signaling pathways. That I told you that most of them is very difficult. So how you will be able to remember it? Revision, question solving. Alright, so I think that's all for endocrinology. I hope this video is helpful to you. And if you like more and more videos, if you want more and more videos, comment down the section. And please don't forget to subscribe, like and share. And whatever improvement you need, please mention down the comment. And this is the first video, it will be up and down, so we will try to analyze, we'll try to improve on daily basis. Alright, so and don't forget to follow us on Instagram, Neurodoc, and any doubt, feel free to comment and DM. With this, I take your leave. Keep studying and make yourself proud. Bye bye.